So hi everyone, I am Shirami Aparicio, your second year student nurse from Davao Doctors College. And today I'm going to perform a Leopold's maneuver. So the maneuver is standard palpation of the abdomen for assessing the fetal position, presentation, and degree descent. So now the first thing to do is to perform the hand washing to prevent the spread of the microorganisms. Then greet the client politely. Then introduce yourself as verify a client using the two identifiers and ask the client on how she would like to call during the assessment. And don't forget to establish good rapport so that the client won't feel uncomfortable. Then now explain the procedure to the client and give the client opportunity to ask or raise her concerns. So this procedure can be performed with full bladders. So let the patient empty her bladder first before the procedure, because emptying your bladder promotes comfort, and of course it allows a productive palpation because fetal contour will not be obscured by a descendant bladder. Hello ma'am, I am Shirami Aparicio, your attending nurse for today. So first, may I know your name? Okay, so when is your birthday? So is that okay if I'm going to check the wristband? Okay, so by the way ma'am, the procedure that I will be doing is that I'm going to perform the Leopold's maneuver. So this is to determine the position and light your baby inside your tummy. So I'm going to touch some part of your body. So is that okay with you? So do you have any questions or clarifications? Okay, so as you can see now, the curtains and doors are already closed so that there will be no other people outside can disturb us while doing the assessment. And I will assure you that this won't hurt you and your baby, so don't worry ma'am. So before your procedure or the assessment, do you feel any pain or are you uncomfortable? Okay, so let's start right away. Okay, so let's empty your bladder first. Okay, let's go ma'am. So the first thing to do is to position the patient into a supine position with a pillow under her head and his knees slightly flexed, and this is done for us to facilitate the accurate adjustment. Then, giving comfort and with slightly flexed knees or put some towel here it, and it can relieve the tension of the abdominal musculature if you are right-handed, and stand at the patient's right and slightly lift her shirt and expose the specific area only. And do not forget to ask permission first before doing so. Okay, so now I'm going to put some towel here. Okay. So I'm going to expose your abdomen. Is that okay with you? Okay, so now let's do the first maneuver. So face the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. And this is to determine if the baby's head feels hard, round, and freely movable and ballotable. And of course, the nodular is softer. So now I'm going to palpate your tummy. So for the second maneuver, palpate in the downward direction on the side of the abdomen by applying a gentle but deep pressure for us to determine the position of the fetal extremities, the fetal back, and the anterior shoulder. And of course, this is to determine if the fetal back is in a continuous structure and the side of the extremities feel nodular and reflects the portion of the fetal. So now for the third maneuver, place one hand into the symphysis pubis and grasp the lower uterine at the segment between the thumb and the fingers. Feels the presenting part, and this is for us to determine if the engagement has occurred, and of course if the photon feels in the pelvis, and also if the head is in the pelvis and it is in a 0% percentage part and still movable, and this means this is not yet engaged. So in the fourth maneuver, turns and face on the patient's feet to confirm the findings into the third maneuver, and determine the fusion of the fingers into the pelvis. And this is for us to know if the cephalic prominence is felt on the side and where there is a greater resistance to the descent of the vertex. So then locate the back of the fetus, then place the bell of the stethoscope over it and listen to the fetal heart tone in 1 full minute. And for us to know if the baby's heart is normal, and we should hear a 120 to 160 beats per minute. Okay, so note for the location rate, character of the fetal heart tone, for the documentation and record afterwards. And make sure that the patient is comfortable and document the observation and main the fetal findings and presentation, position, attitude, and whether the engagement or a floating to promote the database for the future. And after finishing the procedure, do not forget to wash your hands. Okay, so ma'am, we're done with the procedure. So I will be cover you now. Okay, so are you comfortable? Okay, so after the procedure, I have determined that your baby is at your right side and that your baby is in a cephalic position, which means the head of the baby is at the lower part of your uterus and it is already engaged, and this is an ideal position of the baby for labor. And also, when I was listening to your baby's heart sound, I have counted and it is a 125 beats per minute, and that is normal. So, okay, do you have questions? Okay, so ma'am, thank you for your cooperation.